and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening and welcome to BronxTalk, now in its 17th year, one of New York's longest running weekly talk shows. The phones are open tonight. We welcome your input into the dialogue, so give us a ring, have your say at 718-960-7241. You can also email comments to us at bronxtalk@hotmail.com, and we'll read those on the air during a future edition of our program. Well, it's no secret that the health indicators for the people of the Bronx are not good, and the prospects for turning the trends around are a complex challenge. Tonight's guests have some out-of-the-box ideas that take a direct look at lifestyles and basic daily habits. In particular, a new building in Longwood designed for healthy living. Can this work? Can it be duplicated to have greater impact? Let's find out about this and other things. Welcome to Blue Sea Development developer Les Bluestone. Good evening. Thank you for joining us.
Well, thank you for having me.
And also from Doctors for a Healthier Bronx, Dr. Sunil Janjani. Thank you so much for joining us. Welcome back to the program. Always great to have you.
Great to be back.
Mr. Bluestone, let's start with you. I thought this was one of the most exciting developments I had heard in the Bronx. Seems relatively obvious to me that you could have a building that emphasizes healthy living. Talk to me about the Melody and its origins and where it's at right now.
Well, the Melody is an affordable housing co-op. It's a for-sale ownership housing, 63 apartments in an 8-story building. It was part of a New York City Housing Preservation and Development RFP that we applied for. And the building is affordable to families at 2 different income levels, 80% of the average median income and 110% of the average.
Give me what those round numbers are.
Yeah, they're adjusted for family size, so roughly it's as low as $30,000 up to $90,000.
But there is a philosophy running through this building, running through the Melody. Tell me what that philosophy is.
Yeah, well, the idea of the building is to try and encourage physical fitness and health in the inhabitants, in the occupants, the people that buy there.
How does a building do that?
To make it as easy as possible. So one of our tricks or one of our strategies is to encourage the use of stairs. And we do that in a few ways. One is to make it a more enjoyable experience. So we have artwork and music in the stairwells, no music in the elevator.
So rather than being the dingiest, darkest, most unfriendly place, you make it a place like, hey, if you're going out, this is part of the building.
Yeah, we changed all the doors. They're not steel doors now, they're glass doors, so that you can see in and to encourage you into the space. We slowed down the elevator a little bit, so it makes using the stairs a little bit more enticing.
Well, I have to tell you, and people who live where I live know that our elevators are terribly slow, but I wish the stairwells were nicer, but that's slowed down for a different reason. So they're saying, well, if you want to take the time, you can use the elevator. If you want to go faster, run down the stairs.
Exactly right.
That's kind of clever. Dr. Sanjani, I guess this fits right into the idea of Doctors for a Healthier Bronx, doesn't it?
That's true, Gary. The most urgent public health crisis facing the Bronx and New York City are obesity and diabetes. And we know that the primary cause is because of an energy imbalance. We are taking in more than we expend. So anything that we can do to burn more energy and correct that imbalance would definitely help. It would lead to a much more livable and hospitable borough in New York City. And I must commend Les for the wonderful, what I just heard is absolutely fantastic. And I must say that he's the first developer, I believe, in New York State to design and construct a building that actually encourages the occupants and the visitors to lead a more physically active lifestyle. And that will exactly make us burn more calories and try to adjust that energy imbalance that we all suffer from.
The word that I used when we greeted each other this evening was, well, when you look at this building, this is win, 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 win. I mean, this just works for everybody involved. And for any family, any parent who says, well, I certainly want my children to grow up and be healthy, this would be the kind of place they'd want to be in.
I'd love to tell you that we thought of this ourselves and it was our great idea.
Go ahead, take credit.
But it's not. And we followed what were issued a couple of years ago, the New York City Active Design Guidelines. And that's a design guide issued to architects and engineers and developers and owners to how they can encourage the physical fitness in their own buildings.
As a developer, and you know, I don't want to say there's a war between tenants and developers, but there's a lot of this between tension out there. Is this a difficult or an easy line to cross to say, well, we're going to do it this way versus maybe the old way? In other words, is it more expensive? Is it more difficult? Do you really have to make a commitment to say, well, we're going to do it this way, even though it kind of is not the easiest way to do it?
It is more work, and if you want it to work well, then you have to make a commitment to it. You can't do it kind of halfway. You really have to do it all the way. So in addition to the stairs, we have a fully equipped gym that I would say rivals most.
We're going to show some pictures, by the way.
Most gyms that you'll find out there, and we have an outdoor fitness path with exercise equipment as well. So we really try and make it comprehensive.
And we're going to talk, by the way, about Doctors for a Healthier Bronx, and we're going to give you,
Sure.
Dr. Janjani, a chance to really promote that as well. But we're going to show some pictures of the building. One thing, just before we get to the pictures, there is something called LEED certification, which I don't want to say you bent the rules, but you reinterpreted what LEED certification is about to support the building of this. And this, in a way, is a message to other developers. So explain what LEED certification is and how you were able to apply it so that we had this incredible concept now in the Bronx.
LEED certification is issued by the U.S. Green Building Council, and it's a way to measure a lot of different things about a building. It's energy efficiency, its sustainability, meaning how much impact it has on the area, and also its healthiness. Indoor air quality is a big part of LEED. In this particular building, and there are different ratings. There's certified, silver, gold, and then platinum is the highest. This is a platinum rated building, so it's achieved the highest rating it could achieve. And
that was, of course, by design. You said, well, we certainly want to comply with this, and then you get kickback or support for putting the building together.
We get no financial support involved in getting a LEED rating. There is, no financial, unfortunately, no program out there. But one thing that's interesting is that this building we applied for with the city's help, with the Active Design Guideline people, what's called an innovative design credit for the implementation of the Active Design Guidelines, and it's the first residential building to receive this credit.
Mm-hmm. We're going to show. Let's start running some of those pictures, Jane. Let's get these pictures up there. I want to show. This is what the building looks like. While you look at that, list some of the groups, and there were others who participated in this. Habitat for Humanity is part of it.
Yes, we partner with Habitat for Humanity. This is our second project with them. We had set aside 14 of the 63 units where families who were purchasers, family partners they're called,
mm-hmm.
they come and they work in the building along with volunteers and build their apartments.
Mm-hmm. So here's now a look at, obviously at night, but let's move it ahead. We can see some of the hallways, and this is, I guess, the lobby of the building. Spaciousness is one of the things I thought that seemed to work out real well. Look at the size of the hallways. So if you want to visit your neighbor, you got to walk a little bit, right? Yeah. And if there's anything else you want to jump in and tell us about.
Well, the building is named the Melody. One of the things that, when we started the building, it was named Prospect Macy because it sits on the corner of Prospect and Macy. Terribly uncreative. And we saw an article in the Times called Morrisania Melody, and it quoted a Fordham University professor who was reciting all of the musical history in this area.
I can say he's been on our show a number of times.
Mark
Dr.
Nason.
Mark Nason.
Right, exactly.
And he's a historian about the music and the history of music in the Bronx.
And I said, I have to meet this person. And I went to his office, and we sat and talked, and then I came back, and we went out to lunch, and he kept filling me full of more stories of the area. And we said, we have to do something about that. And so we commissioned an artist, Beatrice Caron, to do all of the ornamental art.
I think we have some pictures. Can we jump in and grab some of those pictures of the ornamental artwork?
Right, and it's to pay tribute to an incredible legacy for this area. I mean, no place else that I know.
And why do this? Why, Jane? Can we get some of those pictures up there? I'd love to see some of those pictures. But why do this? Why do something like that? See, there's some of the artwork.
Yeah, that's some of the ironwork looking out onto the backyard. For us, it makes us feel good. That's really the simple thing.
But Dr. Janjani, there must be some health aspects. You feel better. This is part of your community,
right?
Right? There's got to be state of mind health, measurable health characteristics here.
Right. Right. I agree. And as you mentioned, we as a community, we fare very poorly when it comes to select health factors, health parameters, health indicators, and health outcomes. So anything that we can do to change things, and how do we make the community healthier? How do we promote community health and wellness? And that's what we doctors started doing. And we said, let's do something different. Let's get out of our chairs. We are too comfortable in our chairs in our offices. We are too comfortable in our offices. Let's go out and meet with the community. And we started walking with the community. In the beginning, it was just a couple of us walking with a few of our patients on Pelham Parkway, and it's beautiful, absolutely, in the evenings. And slowly and steadily, we have grown, where we have now 200 doctors on the network. We have officially become a nonprofit 501c3 organization. We have volunteers from all facets of society. It's not just doctors, but we have volunteers.
So this commitment that Mr. Bluestone is talking about, in the borough of the Bronx, and that's of course our canvas here, is a larger thing, and it's not just this one man and his Blue Sea Development Company.
Right.
It's also the entire medical community, which is the largest industry in the borough.
Right, but if you look at the Obesity Policy Action Network, and or the framework as you call it, it's put forward by the World Health Organization, the Centers for Disease Control and Prevention. And the building, the Melody House, actually is a very typical example of an upstream socio-ecological approach to combating obesity and diabetes. And if you look at the way things are divided, you can divide it into a couple of ways as to how you can approach this problem. And it's not just in the borough of the Bronx, it's not just in New York State, it's all across the United States today, and in fact, it's become a global phenomenon. There are more obese and overweight people in the world today, Gary, than undernourished kids.
But you know what really, to me, helps to put it together is when he talked about the incomes necessary. Because people, frankly, with more money have better access to these kinds of things. But being able to do these innovations in a neighborhood that is traditionally a poorer community is a wonderful thing. What I want to do, let's show a couple more pictures from inside the building, and then there's these gorgeous kitchens. One of our production people was drooling and saying, I want to live there. So let's run through some of these. This is what the interior of these apartments are, beautiful and spacious.
Amazing.
Keep going. Let's just run through the photos. There's more. Look, you get a little washer and dryer, I guess, on the inside as well. Yep. There are terraces. Keep going, Jane. Let's just run through these pictures. Let's get to the next one. There's the bathroom. Nice and spacious again also.
Nice.
Keep it going. Don't hesitate. There we go. Now this is what I want to show you. This is a fitness room that is in the building.
Yeah.
Now is there an instructor, or people can use it? How does it work?
It's a part of their home. It's an extension of their apartment. There's no fee. There's no charges to pay. They just can fall out of bed and into the gym.
And Dr. Zanjani, you like that idea?
Of course, I love it. This is great.
This is how you make people healthier. So it really is simply the cost of putting it together, and you just fit that into the infrastructure of the building. Is there any trick to doing the economics of that, or it works out very well?
No, it's a struggle. Affordable housing, you're always between a rock and a hard place because the costs are always going up and the incomes do not. So you're always compressed. But we're good at what we do, and my partner and I are willing to, do things that we think are right.
Let's run through the last couple of pictures, then I want to talk more about Doctors for a Healthier Bronx. Now, this is looking down on the yard and, again, making it attractive to youngsters.
Yes, that shows some of the artwork that the artist came up with those designs, and different fitness stations and the equipment is set up for children and adults. So
right. Let's keep going. Let's run through these pictures kind of quick, folks. There you go. You get an idea of what they look like.
Leg presses, yeah.
Right.
And rowing machines.
And there's, again, back to the idea of the melody. Now, one of the things that you told me about beforehand were the signs in the building. In other words, it's not only the structure of the building. And we both, Dr. Janjani and I, laughed over it. What are the signs? You have actual things literally encouraging people at all times. What do they say?
We have these motivational signs, we hope, at the elevator and the doors, and some are somewhat funny, some are very straightforward.
Go ahead. Come on, what do they say?
Well, there are some that's, let's see, now that you caught me off guard, one of them is... it's basically at the elevator, it says no waiting one door over, and it points to the stairs, which are given the same prominence as the elevator. And as I said, we slowed the elevators down a little bit. We have others that encourage, a little tongue-in-cheek, the one that says, if your dog is fat, you're not getting enough exercise, and lots of things along those lines.
Can we go to the telephone, Jane? Mark from Pelham Parkway, our buddy Mark is calling us. Hi, Mark, how are you?
Hi, Gary. Gentlemen, I think that building is great.
I'm assuming Mark usually complain about everything. You must like what you see here.
But I do have a comment, and I'm just going to leave it with this. You want to have a healthy Bronx? You want to have a healthy New York? One, they have to start cleaning up the air in the South Bronx area. And number two, national health care, like they have up in Canada and France and England, because when you have national health care, what it stresses is prevention rather than
Mark,
treatment.
I'm not disagreeing, and we can certainly have Dr. Janjani comment on it. It's a little out of the context of our show today, but so is
No,
there
I don't
something...
think so, because if you're saying a healthy Bronx,
Well,
the only way you're going to really
all right.
get health is when you're
All right,
talking
Mark.
about poor neighborhoods, you need a national health care plan.
I'm going to thank you very much. We'll let the doctor weigh in on that.
Right. No, I wouldn't say it's out of the context here that we are talking. If you go to look at what President Obama passed in the Patient Care and Affordable Care Act of 2010, there are incentives in there for communities to get healthier. There is a community transformation grant, which we actually as an organization are planning to apply for. And it basically provides funds for communities that get together and try to, change the course of chronic illness in the country. And especially obesity and diabetes are the leading chronic medical illnesses. So there are community transformation grants out there in the Affordable Care Act. In fact, President Obama's main talk about the healthcare reform bill is that workplaces have to provide an environment that promotes healthy living. And in fact, there are grants in there where you can provide employers with the funds to provide employee wellness programs.
And so this is a way of incorporating certainly some of the philosophies here. Is there anything like that in housing? Or maybe I should ask, maybe we ought to do something in housing, which Mr. Bluestone is already a leg up on all his competition if he does that.
Right. Actually, I'm surprised because Les just mentioned that there are no financial incentives, there are no tax breaks or anything that he has gotten for building this.
But look at how much money he might save all of us on health care by implementing
Exactly.
this.
So I wonder if some incentive can be put later on down the line. If this is the first building in New York, in New York State, to go along these lines of the active design that was, put forth by Mayor Bloomberg's office. And, It came through the Department of Health and Mental Hygiene, and through the Department of Transportation, I believe,
DDC,
and the DDC. So
and planning also.
And planning. So there are so many things.
You know, I'd like to think maybe we're onto something here, because certainly as soon as I heard about it, I said this is something we have to promote. This little thing that Doctor, you brought to us, it actually interfaces with the building and with what Doctors for a Healthier Bronx are all about. It's a very little. What is this?
It's a pedometer, and in fact, I would like to offer Les at least 100 of those if he wants to give out to the first occupants of the building.
Oh, that
and
would be
they can
wonderful.
measure their steps up and down instead of taking the elevator. The elevators, they measure 0. If they walk up the steps, every time they move something, it records it, and you need a minimum of 10,000 steps
So
a day.
we just cut a deal here on the program. So if you give that to the residents there, it helps to encourage them to walk.
Right.
You gave me a number before we started when I looked at this pedometer.
Okay.
How many steps should a person take every day?
If you really want to maintain an active lifestyle and you want to start cutting down on your body weight, that then it's minimum 15,000 steps a day. For 5,000 steps is just basic. You won't be burning extra calories.
And the answer to the question I'm holding in my hand: how will people know how many steps? You put one of these on your
Exactly.
belt, and then all of a sudden it'll count just
Right.
by going like this.
At
I
the
just
end
did
of the
another
day-
500 steps.
Yeah, that won't. No, it won't do that. Right.
Les, I guess that's you accept.
it's a great
But
offer.
one piece, and I do want to talk more about Doctors for a Healthier Bronx. One piece we did not mention: applications for the building. Many of our viewers are going to go, "Uh-oh, I got to apply." What's the status of it, and how do you get an apartment, or are they already all taken?
No, they're not. We're about 40% sold right now, 40 to 50%. So there's still apartments available, and there are signs up at the building. There's a phone number, and I think you're going to list it later
we
on.
can put the Jane, whenever you want, you can put that phone number up there. All right, now I do want to just slightly shift gears, and because the whole idea is a healthier Bronx, this T-shirt, we got so much stuff to show tonight, is the Healthier Bronx, Walk the Bronx T-shirt. Dr. Janjani,
There's
tell
a
me
good
little
message
bit.
at the back too.
On the back?
Oh yes, it talks about
Okay.
stay healthy, walk daily.
Walk daily. Tell me about what you have done and what you do now every week. We have some pictures and things to show as well.
Right.
Many visuals tonight. Go ahead.
Right. Actually, we have two flagship walkathons, one in the spring and one in the fall. But in between the two, we have daily walks. Weekly walks. Every Tuesday, we walk at 5:30 in the evening. We walk on Pelham Parkway. We walk between Eastchester Road and Williamsbridge Road and back and forth. It's a good about 1.7 miles. And all our participants absolutely love it.
It's not a, frankly, 1.7 miles is not a ton of mileage, but it gets people walking. It certainly helps them on their way for their 10,000 steps.
10,000 steps, right. And in addition to that, we are doing a number of things during the year. We have an after-school program that we work with our wonderful medical students at Albert Einstein College of Medicine. And we have been doing this during the winter months. For the first time this year, during the winter months, we had the gym open at PS 89. And we conducted after-school programs, nutrition education, choreographed dancing, a little bit of yoga, and so on and so forth. And let me just tell you this, Gary. This is not just a doctor-driven thing, and it's the whole community is behind us. Like I
How
mentioned,
could you not be behind this? This makes so much sense. And I have to jump in, and our friend Mark talked about healthcare. One of the things in the healthcare bill is preventative healthcare.
Right.
But that's when you visit the doctor. This is preventative healthcare.
Yes.
This is exactly
yes.
what
In
it is.
fact, we doctors are best equipped to talk about the health consequences of obesity, as I mentioned. And more than that, I think doctors have to take stewardship of the healthcare system. That's the only bottom line how you'll bring down the cost and improve the quality and improve outcomes.
So you do this by conducting walks, and frankly, you're helping the community get healthier.
Well, we are trying, but again, we have so many partners. Our biggest partner is Montefiore Medical Center. Mm-hmm. And Dr. Steven Safia, who's the president and CEO, has basically given us a lot of support, a lot of encouragement. and thrown all the resources of Montefiore behind us to help us conduct these initiatives.
And these kinds of, we're almost out of time, and these kinds of partnerships are vital. Les, you were telling me about Mount Sinai is involved with your next project. We only have a minute or so, so just give briefly what that is.
We have a new building that we're doing, and Mount Sinai received a grant from the Robert Wood Johnson Foundation to study, clinically study the effects of active design guidelines on the occupants of the building.
These are the kinds of partnerships, I think, that are just going to work, as I said, in preventative healthcare. We did put your email address, the info address, so people who want to contact and find out more about it. And
the Bronx needs it more than Manhattan.
The Bronx needs it, frankly, more than anywhere. I opened the show by talking about health indicators.
Right.
It's a problem. We did a show, and we're going to talk about the idea of access to the Jerome Park Reservoir, again, to encourage walking, encourage open space, and all those kinds of things. How do they get to Doctors for a Healthier Bronx? There's a website.
Oh, very simple. We have a website, doctorsforahealthierbronx.org. And, of course, we have pamphlets distributed all across the county that list all the doctors on our network. The telephone numbers are there. They can call their doctor's offices. They can find out when the walks are, when is the next one.
And gentlemen, Dr. Sunil Janjani, thank you so much. Les Bluestone from Blue Sea Development, thank you so much. There really are ways, and I'm going to encourage parents who are watching us to make use of these contacts. Talk to Dr. Zanjani about how you can work in your own community, whether you're where he is or not, and do that. And maybe you'll find an opportunity with Mr. Bluestone to get housing. But gentlemen, thank you for your forward thinking in the Bronx.
Thank you.
We appreciate it. Folks, if you have further comments or questions on anything you heard on tonight's show or anything going on in the Bronx, then email them to us at bronxtalk@hotmail.com, and we'll read them on the air during a future edition of our program. Archives of Bronx Talk available at bronxnet.org. You click Bronx Talk on the right-hand navigation bar. And, of course, next Monday night, we'll be back at 9 p.m. for Bronx Talk. Thanks to producer Jane Folloro, director Michael Arias, to Dina, and our cast of thousands who helped with all the different visuals and things we had going on tonight. And to you, good night.
Yep.
Stay where you are. Don't get up. All right.